All right, we're going to wrap up Lenny's 9th week of her rotation, and I know what you're asking yourself. Do I make students wear the same color shirts that I wear when we're in the clinic? And obviously I do, because how else would this work out? I actually text the student the day of work and say, hey, the color today is lavender. So that's how we work this out. So when you're a student here, just make sure you bring a lot of different colored t-shirts, mostly red and black, but some other stuff too. So I'll let Lenny tell you about what she learned this week, or what she's kind of been working on as she's been going the last 9 weeks.
Yeah, so this week I think my big takeaway was working with patients who come in with complaints in multiple body parts or areas of the body, whether it be shoulder, hip, back, and treating them as a whole person as opposed to the one body part that oftentimes we learned in school or have learned in other clinicals, that when patients come in, oftentimes they relate it to insurance will only let you treat one area of the body per visit. So here, since we do the full body screen, we see how everything is working together and how they function as a whole, which I think is really important and really different here compared to other places. And it's really effective because when someone comes in with hip issues, we learn in school, but don't always use it in practice. The opposite shoulder could have implications in that and things like that. So really connecting parts of the body, making sure you're treating them all over, and that can have a really big impact on the one area or multiple areas that were affected.
So on the first day that you walked in, if I said, hey, if you have a patient come in that you're doing an eval on and they complain of plantar fasciitis and knee pain and low back pain and headaches, and I said, so make sure you evaluate all that stuff. How mind blown would you be? How scary would that be, trying to go into that kind of a scenario doing evals the way you learned in school?
I think that it would be really intimidating. Evals we learn in school, it's very body part specific. So you're testing passive and active range of motion in every single movement and position, and MMTs for every muscle. So here, doing a more general screen and focusing more on NFTs as opposed to all of those minute details of one joint in particular, definitely speeds things up a little bit and makes it more functional.
And if I said, hey, at the end of this eval that you see, you're going to have to program exercises for their shoulder and their hip and their knee and their foot. How nervous would you be about giving people exercises for multi-body parts?
I would definitely be hesitant, just knowing that I would probably have a laundry list of things given to them and they probably would not be doing them. So after coming here, learning just to give a couple, 3 to 4 exercises that focus on hip, knee, ankle, all together, low back, moving in aplanar motions so that it really targets the whole body, definitely is more effective than just treating one joint and giving them exercises for that.
There you go. So if you're a student and you're going out in clinicals, you're probably figuring out that a lot of stuff that you role play in school doesn't really happen. But now, listening to Lenny talk, you should understand that there is a way to treat the multi-diagnosis patient effectively, quickly. Yes, you can bill them for that. Yes, there is a way that you can do that and not violate insurance and all that stuff. But at the end of the day, we don't work for the insurance company or the referring physician. We work for the patient that's coming in. And on top of that, doing patient education and exercise prescription, if you're giving things to patients that is patient specific versus just going and grabbing handouts per diagnosis. So if we had handouts for shoulder impingement, plantar fasciitis, anterior knee pain, and cervicogenic headaches, getting all those handouts together and going through those handouts would take forever. But if you understand how to link things together because you understand biomechanics, you can give one exercise that covers all of that they can do quickly, and just like Lenny said, they're going to be compliant with, because A, it makes sense, B, it works, 3, it's really easy to do. So if you're feeling like you're confused with multi-diagnosis patients, if you feel like you're confused with exercise prescription, if it feels like it takes forever to get through things and it doesn't make sense when you get done, it's because you don't have a streamlined thought process and you're thinking the way they want you to think when you go through school and then get into the clinic and do what you're expected to do instead of what you should be doing. So great info from Lenny on week 9. Can't wait to see what she says next week on her wrap up, and see how well our shirts match next week.